Hi guys, and welcome back to EverlastCyber. In today's video, we'll be going through the practice questions and answers for the NACC PSW exam. This is the part 2 video. The part 1 video has already been posted earlier, so you can check that out. Also, don't forget to like, comment, and share, and also hit the subscribe button so that you'll be informed when our next available video will be dropping. Let's dive right into the questions now. Question 1. Care of the aged is called A. Palliative care, B. Geriatric care, C. Pediatrics, D. Respite care. Palliative care focuses on relieving symptoms and improving the quality of life for people with serious or terminal illnesses. It is not specifically for the aged. Geriatric refers to the branch of medicine and care that focuses on the health and well-being of older adults. It includes managing age-related conditions and promoting quality of life in the elderly. Pediatrics is the branch of medicine that deals with children and adolescents, and it is the opposite of geriatrics. Respite care provides temporary relief for caregivers, not ongoing care for the aged themselves. So, based on this explanation, the answer is option B. Geriatric is a branch of medicine that focuses on the health and well being of older adults. Question 2. Soaking linens and items of clothing in cold water before washing is recommended for removal of A. Grease stains, B. Gasoline odors, C. Bodily fluids, D. Ink stains. Grease stains are typically removed using warm or hot water and dish soap, or even degreasers, because it will help to break down the grease, the oil in it. Gasoline odors requires ventilation, special detergents, and often warm water. Cold water is recommended for removing bodily fluids like blood, urine, vomit, or feces because hot water can set the protein-based stains like blood into the fabric and it will make them more difficult to remove. So cold water helps to loosen and lift these stains before laundering them properly. Ink stains are best treated with alcohol-based products and not just cold water. So based on these explanations, our answer is option C. Soaking linens and items of clothing in cold water before washing is recommended for removal of bodily fluids. Question 3. You should not use your dash to locate radial pulse. A. Index finger, B. Ring finger, C. 3 middle fingers, D. Thumb. The index finger, ring finger, and the 3 middle fingers are commonly used and recommended to accurately feel the patient's pulse without interference from your own. This is because the thumb has its own strong pulse, and this can be confused with the patient's pulse, thereby leading to inaccurate readings. So when you're trying to locate the radial pulse, you shouldn't use your thumb because of its own pulse that can be confused with the patient's pulse. So I put up a screenshot of the instructions on how to take a radial pulse. So you place the index and middle fingers at the base of the thumb and slide down about 2 centimeters in the groove in the wrist, pressing lightly. That is how you feel the radial pulse. Question 4. Introduced in 1948, universal hospital insurance became the foundation of the Canadian healthcare system. In which Canadian province or territory did it begin? A. British Columbia, B. Ontario, C. Quebec, D. Saskatchewan. For this, our answer is option D. In 1948, Saskatchewan became the first province in Canada to introduce universal hospital insurance, and this provided coverage for hospital services to all residents. This model laid the foundation for what would eventually become Canada's publicly funded healthcare system, which is known as Medicare. The success of this program influenced the federal government and other provinces to adopt similar plans, thereby leading to national health coverage. Question 5. Gastrostomy tubes provide nutrients to which parts of the body? A. Throat, B. Stomach, C. Esophagus, D. Colon. Looking at option A, food is not delivered here. It is only part of the natural swallowing process. A gastrostomy tube or G-tube is a feeding tube that is surgically inserted through the abdominal wall directly into the stomach, and this is used for clients who cannot eat or swallow safely. It delivers nutrients, fluids, and medications directly into the stomach without having to pass through the throat or the esophagus. The esophagus carries food to the stomach, but it is not the target of a G tube. And the colon is part of the large intestine. However, it is not used for feeding. So our answer here is option B. The G tube is surgically inserted through the abdominal wall directly into the stomach. Question 5. In a community setting, who usually assess, monitor, and evaluates the clients and coordinates the services of the healthcare team? A. Occupational therapists, B. Social worker, C. Family physician, D. The case manager. An occupational therapist focuses on helping clients to regain or develop skills for daily living and work, but it doesn't usually cover overall care. A social worker assists with emotional, social, and financial issues, but does not lead the healthcare team coordination. A family physician provides medical care and may be part of the team, but typically does not handle care coordination in a community setting. This is the job of the case manager in option D. So, in a community healthcare setting, the case manager is a professional who assesses the client's needs, monitors their health status and progress, evaluates the effectiveness of services, and also coordinates care among the healthcare team, nurses, doctors, therapists, and social workers. So they ensure that the client receives appropriate and efficient care tailored to their individual situation. Question 7. Mr. Bell would like to take a bath. When you say, do you want to take a bath? You are A. Augmenting, B. Focusing, C. Paraphrasing, D. Delaying. Augmenting means adding to or enhancing something. Focusing involves guiding the conversation to a specific topic, not restating what has been said already. Paraphrasing means restating what someone has said in your own words in order to confirm understanding. So, for instance, Mr. Bell says, I'd like to get cleaned up, and then you respond, do you want to take a bath? That is just paraphrasing his request. Delaying means postponing action, but it doesn't apply to the scenario we have. The answer that applies here is option C, paraphrasing. This means restating what someone has said in your own words in order to confirm understanding. Question 8. Common signs and symptoms of a foodborne illness are A. Depression and confusion, B. Diarrhea, nausea, and vomiting, C. Headache and chills, D. Inflammation. Depression and confusion in option A are not typical symptoms of foodborne illnesses. Foodborne illnesses, which are also known as food poisoning, typically occurs from consuming contaminated food or beverages. Some common signs and symptoms include diarrhea, nausea, vomiting, abdominal cramps, and even fever in some instances. In option C, while headaches and chills may occur in some infections, they are not the primary symptoms of foodborne illnesses. And for option D, inflammation is too general or it is not specific and it doesn't define the symptom of foodborne illnesses. So based on this, the correct option would be option B, diarrhea, nausea, and vomiting. Question 9. When feeding a client with swallowing problems, how full is the teaspoon? A, 1/3, B, 2/3, C, 3/3, D, full. For this, the best answer is option A. When feeding a client with swallowing problems or dysphagia, it is safest to use small amounts of food, which is usually 1/3 of a teaspoon, in order to reduce the risk of choking or aspiration. When feeding the client, you have to allow the client time to chew and swallow completely before offering the next bite. Also, ensure that they are sitting upright and they follow any specific dietary modification recommended by either a care plan or a speech language pathologist. Question 10. Fall prevention includes A. Encourage grab bars. B. Wipe spills immediately. C. Keep bed high. D. Avoid night lights. Fall prevention strategies focuses on minimizing hazards. Now, if we look at option A, encouraging grab bars would help to maintain balance, especially in the bathrooms. Looking at option B as well, wet floors are a major cause of slips and falls. In option C, keeping beds high will actually make clients to fall. So the bed should be kept low, especially for those at risk of falling. And in option D, night light should be used to improve visibility in the dark and to help prevent trips. While option A and B appear to be correct, the best possible answer is option B. That is the best choice because wet floors are a major cause of slips and falls. So, fall prevention includes wiping spills immediately they occur in order to avoid slips and falls. Question 10. Resistance to infection is the result of taking which of the following vitamins? A. Vitamin A, B. Vitamin B1, C. Vitamin C, D. Both A and C. Vitamin A is important, but it is not complete without an accompanying vitamin. Let's look at option B. Vitamin B is essential for energy metabolism, but it is not directly linked to immune defense. Vitamin C enhances immune cell function, especially white blood cell. It also acts as a powerful antioxidant and it protects cells from damage by free radicals. It also promotes healing and helps the body to absorb iron. So, looking at the options, the correct answer would be option A and C, and that is option D, vitamin A and vitamin C. Vitamin A maintains the health of the skin and mucous membranes, which is usually the body's first line of defense. It also supports the function of white blood cells that fights infection. Now, when it works hand in hand with vitamin C, which enhances immune cell functions, it helps to create resistance to infection in the body. Question 12. The breathing of fluid or an object into the lungs is called A. Gavage, B. Aspiration, C. Dysphagia, D. Regurgitation. Gavage refers to feeding through a tube, and it is not related to breathing fluid into the lungs. Aspiration, on the other hand, is a medical term for inhaling food, liquid, saliva, or other objects into the lungs. This can lead to aspiration pneumonia, which is a serious lung infection, and it is usually common in individuals with swallowing difficulties or dysphagia. Dysphagia means difficulty in swallowing, and this can lead to aspiration, but they are not the same thing. Dysphagia is different from aspiration. Regurgitation means the backward flow of food from the stomach into the mouth or throat, but not into the lungs. So, the correct option here is option B. This is the medical term for inhaling food, liquid, saliva, or other objects into the lungs. Question 13. Which is not allowed when you are on your meal break? A. Making personal phone calls. B. Meeting family members at your workplace. C. Leaving the unit after informing the nurse you're taking your break. D. Taking a few extra minutes to returning back on time. When you're on a meal break, you are typically allowed to make personal phone calls. You're also allowed to meet family members, but that is if your workplace policy allows, and you have to ensure that it is done appropriately. You can also leave the unit as long as you have informed the nurse or supervisor. However, taking extra time beyond your scheduled break is not allowed. This is considered unprofessional and it can disrupt staff schedules and client care. So, option D is not allowed when you are on your meal break. Question 14. Deprivation of food or clothing is A. Emotional neglect, B. Physical neglect, C. Sexual abuse, D. Physical abuse. Emotional neglect involves failing to provide emotional support, love, or attention, but that is not the scenario we have. Physical neglect refers to the failure to provide for a person's basic physical needs, and this includes food, clothing, shelter, and medical care. Deprivation of food or clothing falls into this category of neglect, which is physical neglect. Sexual abuse involves any sexual activity with a child or a client, and physical abuse involves causing physical harm or injury. Based on the scenario we have, deprivation of food or clothing, this falls under physical neglect, and that is option B. Question 15. Abusive behaviors include A. Pushing, B. Swearing, racial slurs, hitting, C. Inappropriate touching, D. All of the above. Abusive behaviors can take many forms and they include physical abuse, such as pushing or hitting, verbal or emotional abuse, such as swearing or using racial slurs, and also sexual abuse, which is inappropriate touching. So, abusive behaviors includes all of the above that were mentioned. Question 16. Assistive dining involves A. Clients serve themselves, B. Feeding to reduce stimulation, C. Restaurant style service, D. Group feeding by PSW. Option A is more like self-service and not assistive dining because the clients are serving themselves, so it is self-service. Option B doesn't align with assistive dining, which aims to enhance the experience. Assistive dining refers to creating a pleasant, supportive mealtime environment that encourages independence and dignity. This often includes serving food in a manner that is similar to restaurant style, individual plates, nicely presented. Also, helping the clients as needed, but encouraging them to eat independently as much as possible, and also reducing distractions and making mealtime enjoyable. In option D, group feeding refers to feeding multiple clients at once, and this is not specific to assistive dining. So, based on the explanations, assistive dining involves restaurant style service, and that is option C. Question 17. Stage 2 dementia safety includes A. Allow smoking anywhere. B. Remove sharp objects. C. Only prevent night falls. D. Toilet clients twice daily. In stage 2 dementia, individuals may begin to have more difficulty with judgments, safety awareness, and coordination. So, in order to ensure safety, what you need to do is to remove sharp objects like knives, scissors, razors, and also help to prevent accidental injury or harm. That is option B. For the other options, option A is unsafe because smoking should be controlled and supervised. Even if it's allowed, it has to be supervised. In option C, falling can happen at any time, not just at night, so safety measures have to be comprehensive. In option D, toileting should be based on the individual's needs and not on fixed schedules. So our answer is option B, removing sharp objects. Question 18. An open wound on the lower legs and feet caused by poor return blood flow from the veins is called A pressure ulcer, B. An arterial ulcer. C. A stasis ulcer. D. A thrombus. Pressure ulcer is caused by prolonged pressure, especially over bony areas like the heels, sacrum, and it's not caused by poor venous return. Arterial ulcer is caused by poor arterial blood flow, lack of oxygenated blood, and not venous congestion. A stasis ulcer, which is also called a venous ulcer, usually occurs when there is poor blood flow in the veins, and this causes blood to pool in the lower legs, leading to ulceration or skin breakdown. A thrombus is a blood clot and not an ulcer, although it may contribute to poor blood circulation, but for the scenario we have, it doesn't apply. So the answer here is option C, a stasis ulcer. Question 19. Delusions of persecution involves A. Poor judgment and morals. B. Not caring for self. C. Feeling mistreated or abused. D. Experiencing unreal things. Option A is not related to delusion, so that is not our answer. Option B refers to neglect or depression. It doesn't apply to delusions. Delusions of persecutions are false beliefs where a person feels that they are being targeted, mistreated, spied on, or abused by others, even when there is no evidence. In option D, this describes hallucinations, that is, experiencing unreal things. It doesn't apply to delusions. So the answer here is option C. Delusions of persecution involves feeling mistreated or abused even when there is no evidence. Question 20. Falls by older adults who live at home are best prevented by A. Reducing clutter from pathways. B. Reducing bright lighting. C. Providing daily safety classes for older adults. D. Preventing older adults from living by themselves. Falling in older adults living at home usually happen because of tripping hazards. So, in order to prevent this, you have to keep the pathways clear of clutter by um, and this will make it easier for them to move safely and also reduce tripping risks. Options B, C, and D would be incorrect because good lighting actually helps to prevent falls by improving visibility. Option C is helpful, but it is not always practical or effective daily. Option D is restrictive and not necessary if the safety measures are already in place. So, based on the explanations, falling by older adults who live at home are best prevented by reducing clutter from pathways. And that is option A. Question 21. The goal of the healthcare team is to A. Provide quality care. B. Make money. C. Provide case management. D. Assign tasks and responsibilities. The primary goal of the healthcare team is to provide quality care to patients and clients, ensuring their health, safety, and well being. In option B, while financial sustainability is important, it is not the main goal of the healthcare team. Option C is one part of care, but it's not the overall goal. And option D is part of team coordination, but not the ultimate goal. So, out of these options, the main goal of the healthcare team is to provide quality care, and that is option A. Question 22. MSDS stands for A. Metals and solvents data sheets, B. Material safety data sheets, C. Medical survey data sheets, D. None of the above. For this, we'll be going with option B. The material safety data sheet is a document that provides important information about the properties, hazards, handling, and emergency measures related to chemicals or hazardous materials. Question 23. Frequent urination at night is referred to as A. Nocturia, B. Oliguria, C. Polyuria, D. Glucosuria. Nocturia refers to frequent urination during the night. Oliguria means a decreased urine output. Polyuria means excessive urine production, while glucosuria means glucose sugar in the urine. So the correct answer would be option A, nocturia. Question 24. What is the goal of bladder training? A. To allow the person to walk to the bathroom. B. To remove the catheter. C. To gain voluntary control of urination. D. All of the above. Option A may be part of the process of bladder training, but it is not the main goal. Option B is a step in the plan, but it is also not the main goal. Option C is the main goal because this will help the person to regain voluntary control over urination, and this is particularly useful for individuals recovering from illnesses, surgeries, or those with incontinence issues. So the answer here is option C. The goal of bladder training is to gain voluntary control of urination. Question 25. The best behavior for a support worker when feeding a client is A. Telling a resident the value of each type of food. B. Appearing patient and calm. C. Feeding one kind of food before starting another. D. Talking about the client's family without knowing if they visit. When feeding a client, it is important for the support worker to be patient and calm in order to create a comfortable, supportive environment that encourages the client to eat well. So our answer is option B. This brings us to the end of the practice questions and answers for the NACC PSW certification exam. Don't forget to like, comment, and share, and also hit the subscribe button so you'll be informed when our next informative video will be dropping. Thank you for watching, and I'll see you in the next video.